Bioavailability, F, is the fraction of an administered dose of a drug that reaches the systemic circulation in an unchanged form. When a drug is given intravenously IV, bioavailability is 100% because the drug directly enters the bloodstream without needing to be absorbed or undergoing first-pass metabolism. For orally administered drugs, PO, bioavailability is typically less than 100% due to factors like incomplete absorption and first-pass metabolism. The area under the curve, AUC, on a plasma concentration versus time graph, represents the total drug exposure over time, which allows clinicians to calculate bioavailability. For example, AUC IV, horizontally striped area, indicates the AUC for an IV dose, typically providing 100% bioavailability. AUC PO, vertically striped area, indicates the AUC for an oral dose, which is often less than 100% due to the drug's incomplete absorption and first-pass effect. The bioavailability of an orally administered drug can be calculated by comparing the AUCs for oral and IV administration. This equation shows how bioavailability is lower when a drug has undergone significant first-pass metabolism. When a drug is absorbed from the gastrointestinal GI tract, it enters the portal circulation and passes through the liver before reaching systemic circulation. During this first pass, a fraction of the drug may be metabolized or inactivated by liver enzymes, reducing the bioavailability of the drug. This effect is quantified by the hepatic extraction ratio, ER, which measures the proportion of the drug removed by the liver during its first pass. The systemic bioavailability, F, of an orally administered drug can thus be predicted from both the fraction of the drug absorbed from the GI tract and the hepatic extraction ratio. This formula shows that as the extraction ratio approaches 1, high first pass effect, bioavailability decreases. A drug with an ER of 0.8, for instance, would have only 20% of the absorbed dose reaching systemic circulation. Hepatic blood flow, Q, typically around 90 LH for a 70 kilograms adult, is another key factor influencing bioavailability, especially for drugs with high extraction ratios. Drugs with high ER are sensitive to changes in hepatic blood flow because their clearance rate depends on how quickly the drug reaches the liver. When blood flow increases, more drug bypasses first-pass metabolism and bioavailability rises. Conversely, when blood flow decreases, for example in heart failure, more drug is metabolized on the first pass, decreasing bioavailability. This relationship is summarized as high ER drugs. Bioavailability is directly related to hepatic blood flow, Q. Low ER drugs. Bioavailability is determined mainly by absorption and is less influenced by hepatic blood flow. The route of administration for a drug is essential in clinical practice, often influenced by the need to either bypass or leverage the first pass effect. Different administration routes can be chosen based on convenience, the requirement for localized or systemic effects, and whether first pass metabolism in the liver should be avoided to enhance bioavailability. Drugs placed under the tongue dissolve and are absorbed through the mucosal lining of the mouth, directly entering systemic circulation via veins that bypass the liver. This route avoids the first pass hepatic effect almost entirely, allowing rapid onset of action with greater bioavailability. Example, nitroglycerin is commonly given sublingually to quickly relieve angina without loss of efficacy from hepatic metabolism. Transdermal, through the skin administration. Drugs are administered via a patch applied to the skin, allowing gradual absorption directly into systemic circulation. Like sublingual administration, transdermal delivery bypasses the liver and avoids first-pass metabolism, providing a controlled, prolonged release over time. Example, fentanyl and nicotine patches use transdermal administration to maintain steady plasma levels over extended periods. Rectal administration. Drugs given rectally may bypass the liver depending on their location within the rectum. Drugs absorbed in the lower rectum enter veins draining directly to the inferior vena cava, bypassing the portal vein and the liver. However, drugs administered higher in the rectum are more likely to undergo first-pass metabolism, as veins there lead to the portal circulation. About 50% of a rectal dose is estimated to bypass the liver, making rectal administration partially effective in avoiding the first pass effect. Acetaminophen suppositories are used when oral administration is not feasible, for example, in patients who are vomiting. Inhalation through the lungs. Drugs inhaled as gases or aerosols are absorbed through the lungs' extensive surface area, entering systemic circulation directly. Inhalation bypasses the liver, avoiding first-pass metabolism. However, the lungs may act as a site of first-pass loss by excreting or metabolizing certain drugs through pulmonary metabolism or exhalation. Example: albuterol, a bronchodilator for asthma, is inhaled to target the lungs directly, reducing systemic side effects and avoiding liver metabolism. Parenteral injectable routes: intravenous (IV), intramuscular (IM), and subcutaneous (SC) administration. Parenteral routes deliver drugs directly into systemic circulation or tissues, bypassing the gastrointestinal tract and liver initially. These routes provide 100% bioavailability and avoid first pass metabolism, making them ideal for drugs with low oral bioavailability. Example: insulin, which is quickly degraded in the GI tract, is administered subcutaneously to maintain its effectiveness. Clinical case examples: nitroglycerin and sublingual administration. Nitroglycerin, when taken orally, undergoes nearly complete first-pass metabolism in the liver, making oral bioavailability nearly zero. However, when taken sublingually, it bypasses the liver, leading to much higher bioavailability and providing rapid relief for angina. Propranolol's case. Propranolol has a high extraction ratio, ER 0.75, meaning only about 25% of the oral dose reaches systemic circulation due to first-pass metabolism. This necessitates a higher oral dose or alternative administration route to achieve therapeutic levels in some cases. Influence of hepatic blood flow on morphine. Morphine, which also has a high extraction ratio, has a variable bioavailability that is highly sensitive to changes in hepatic blood flow. Reduced blood flow due to heart failure, for instance, would lead to increased first-pass metabolism and reduced effectiveness when taken orally. Fun facts: grapefruit juice inhibits enzymes responsible for drug metabolism in the liver, increasing the bioavailability of drugs with high extraction ratios, like simvastatin, which can lead to unexpected side effects. Some drugs are designed as prodrugs, activated by liver metabolism to increase bioavailability, thus using the liver's first-pass effect to make them effective. Summary: first-pass hepatic elimination, hepatic blood flow, and the extraction ratio together determine a drug's bioavailability, especially for orally administered drugs. High first-pass metabolism and extraction ratios can dramatically reduce bioavailability, leading to specific clinical strategies like alternative dosing routes or modified drug formulations to achieve the desired therapeutic effect.